It is a Stroke Awareness Month, the month of May, and according to the CDC, every 40 seconds, someone in the U.S. has a stroke. About every 3 minutes, that stroke is deadly. Now, the risk does go up as you get older, but it can happen at any age. Joining us right now, Midday, Dr. Omar Kass-Hout with the St. David's. Thanks for joining us for this morning. We really appreciate it. Could save a life. But what are the signs I need to look out for? Because if I don't know what a stroke looks like, I don't know how to help.
Exactly, and the American Heart Association came up with a simple acronym to be easily remembered by everybody. Be fast. 6 letters to keep in mind whenever you have somebody with stroke. The B stands for balance, so if they're having problem walking. The E stands for eyes, so if they lose vision in one eye or both eyes or partially or completely. Or the eyes look in one way or another. The F stands for face, so if their face is droopy, that's a sign that a stroke could be taking place. The A stands for arm, so we usually ask the patients to raise the victim to raise their arms up. If one arm is lagging behind, that's a sign of stroke. If their speech is not making sense or it's garbled, difficult to understand, that's also a sign of stroke. And the T stands for time. That's the time to call 911 and get to a hospital. While stroke is the 4th leading cause of death in the U.S., the 2nd globally, Rob, there's a lot we can do for it today.
But what can I do today? I know it starts really after 55, the risk gets bigger, but what can I do today to make sure that we're healthier later on?
Exactly, so it's very essential to follow up with your primary doctor constantly. A leading cause for stroke is hypertension, and it's the #1 modifiable risk. There's medications, diet, exercise you can do. High cholesterol, diabetes, obesity, sedentary lifestyle, all these are risks that leads to stroke at one point in time. If there's any family history of arrhythmia in the heart, something called atrial fibrillation, that's also connected very strongly with stroke, and that can be easily treated by a cardiologist or a primary doctor to thin the blood so clots don't form to go to the brain. So that's essential. Prevention is always cheaper and more cost-effective. But when a stroke happens, it's very essential to get the patient to the hospital very quickly.
How much time do you have, we're talking about here, to get them to the hospital before there's damage to the brain that's you can't fix, quite frankly?
That's an excellent question. So what we say in stroke neurology is time is brain. Every second passes by that a brain is not reperfused, the blood is not returned back to the brain. That's 1.9 million cells, neurons, that's units in the brain that die. A brain that is stroking, age in 1 hour, about 3.5 years.
Oh my goodness.
So it's very essential to go to the hospital, and for a lot of patients we can do multiple interventions. One is a medicine that we can give in the vein, a clot buster, that breaks down the clot, and that we can give up to 3, maybe 4.5 hours from time of onset depending on the type of patients. But also in multiple centers in Austin and in the country, we can sneak up catheters in the arteries, whether it's a small cut in the wrist or the leg, and we can go through the arteries of the body like a highway, make it to the site of the clot, and snatch it out or vacuum it out. And we can do that up to 24 hours. Having that said, these are windows that we see benefit from it. But the earlier you make it to the hospital, the more chances you have to become independent. These procedures can be successful up to 80–90%, but unfortunately, maybe 60% of patients
don't get there in time?
Well, they can benefit from it because a lot of patients don't get there in time, yes.
Well, Dr. Kass-Hout, we are out of time. I appreciate it, but thank you so much. It could save a life out there. And we're